Okay, so this is a demonstration of how to apply Kinesio tape to an elbow, specifically for someone who has a ligament strain on the outer portion with radiating nerve pain here. And there are different kinds of tape. This is Kinesio tape. There's also rock tape, spider tape, which are similar knockoffs, which I haven't used. I do like Kinesio tape. So I'm going to show a couple methods. I just measured out by putting it on the body. I know it's going to get about 10% longer than what I measure. I have special scissors that have Teflon on it, so it makes it easier to cut, and it may be a little difficult if you don't have Teflon coated scissors, in which case I will take returns, and you can get the thinner tape and just use more of it, and I will take this and use it in the therapy, so I'll give your money back. So I'm going to cut down the length of this, and I'm going to leave a patch uncut about 2 inches. Doesn't matter too much. You don't have to be too super careful, but I am trying to cut halfway down the middle and leave about 2 inches uncut in the center. Then I'm going to tear the paper on the back right at the crotch of that cut, and I'm going to use a method for ligaments on this inner part. So now I've got these different hangy parts. I'm going to pull off the middle. It's this mobile, stretchy aspect that makes Kinesio tape different and makes it move inflammation really well. It also can decrease pain, and it creates joint support. So I'm going to put the joint, Trevor's joint, in a slight bend. You want to put it on ideally in a bend. So if I was doing the knee, I'd have the knee somewhat bent. And I would wash the area with alcohol first so it lasts longer. The tape will stay on about 4 days up to 2 weeks, and you can leave it on as long as it stays. So I'm going to locate the tender point, and then I'm going to, for a ligament, I'm going to put about a 10% stretch into this. I'm not going to stretch it all the way out. I'm going to stretch it about 10%, and I'm going to place it over the ligament about in the location of the angle of that ligament. Then I'm going to do a technique called tape off tension. I unpeel the backing just a little to get it going. I put my finger behind it, and I'm going to roll down the muscle belly, and I'm not going to lift and pull it. I'm simply rolling my finger behind it to create a stretch. If you don't want to do the 2 legs, you could simply do the same thing with your whole piece of 2-inch tape, if the 2 legs thing is becoming a problem. But the 2 legs allow you to get more anatomical breadth. Then you have to rub it to secure the adhesive. It goes through a little chemical reaction. Do the same thing here, unhooking the edge so that I can grab it. Without pulling it, I simply roll my finger. It's good to look at it with your eyes where you're going to go. I want to go here, I look at that, and I roll towards it. And then I rub it to adhere the tape, and I've secured an area. So if you want to do more area, like behind the elbow all the way up to the tricep or down the forearm, you could simply do another technique. I'll just use my narrow gauge this time. If I wanted to move inflammation up the body, let's say there's still some inflammation across this elbow, I would this time open it from the end, create a tab to stick it on his skin, put it on his clean skin, and wherever you put the tab, that's where the inflammation is going to be drawn to. I want to draw it up his body. I don't want to draw it down to his hand. So I put the tab there, get the little tab here by bending it backwards. If you sit there trying to peel it off, it will take forever. So you simply backward bend it to disadhere the paper. And then you tape off tension, rolling it down, and you can go around corners with this tape, and you look at where you're going to go. And that is going to draw inflammation up this band. This part that we did a 10% pull is going to stabilize a ligament. You could do the same thing on the inside of a knee. You don't need all these bands here. If you just wanted to do a ligament, you could simply put it there and then rub a little bit off the edge to secure a ligament that way. So that's a basic understanding of some basic techniques.